I remember the ambulance ride from the hospital to Regency of Greenville. They wheel me into the room, and there's this flurry of activity getting me set up. Within about an hour, Dr. Walpole came in, and I must have been anxious or fearful or expressing some of that because he picked up on it, and he very gently said, "Give me just a minute." And then he spent about 90 seconds, and he recounted my entire experience. And then he said, "You're in the right place. We're going to take care of you, and you're going to be okay." I was just having a little bit of distress, nothing serious. Went to my doctor. I was being treated for gastritis. And that day at work, I felt progressively worse, and the pain just got so bad I had to come home early. So I called my doctor, and she said, "Go to the ER." So Karen took me to the ER, and it unfolded pretty quickly there. The pain got intolerable.
As they didn't do surgery and debated about doing surgery, he continued to swell, get more uncomfortable, got to the point where he couldn't breathe. It was just so bad and enormous. And they finally, on the 25th of July, did a paracentesis. And at that immediate moment, they realized that something had ruptured in his bowel, in his cavity. He was flooded, he went septic. Within moments, they had him in surgery.
Post-surgical recovery the first time, and then post-surgical recovery the second time, and then post-surgical recovery the third time, we continued to get more and more frustrated. Like, no one seems to have any answer. We don't know what's going on. Why don't we know what's going on? We had started the process of looking at other options because we knew that this could not be continuous. We couldn't keep this up. Regency was proposed, and we went and explored the Regency Hospital in Greenville and really loved what we saw.
Prior to this, we had no concept of what a long-term acute care facility was.
Well, we learned that once we got there, that it was, critical care, and it was for people from different levels of critical care. People being taken off breathing machines and learning how to breathe on their own, to his care for the wound, and then his nutrition, being able to walk again.
They kept saying over and over, "It's going to be this way. You're going to be okay. This will happen." And I reached a point where I believed them. I put my faith in what they were saying, including physical therapy. Mobility of my legs, moving, the mobility, stretching. They'd put the belt that you wear, and we would just stand, using a walker and taking a few steps. But they literally taught me how to walk again.
I was surprised really at how quick he improved when he got into a different environment.
I was with him very surprised when, we would come into the hospital room and he would be standing there. And it was because it had been so long since we had seen Dad in that upright position, looking relatively normal.
I went in August 20th, we came home October 18th. I spent about 2 months just convalescing, just learning the routine, what my limitations were. I'm an accountant, so I was coming up on a tax season, wondering if I had the physical stamina, and frankly, did I lose any mental dexterity? That was a big fear. My boss and I had a meeting, what are your thoughts, what are your plans? And I just walked back in part-time and did little by little. And by the time tax season hit full swing, by the end of January, I was at full capacity. I worked a full load, full hours, a full complete tax season. I was back.
Regency of Greenville definitely played a part in the dad that I see and have now. So going through that experience and then seeing him today is I'm just grateful.